Welcome back to Synchronicity Talk Radio for your mind, body, and soul. That was a promo for DJ Chris Orific. He's going to be up in about 15 minutes here on CITR with Parts Unknown. This is Synchronicity Talk Radio for your mind, body, and soul. I hope you're having a wonderful holiday season. If you're Jewish, happy Hanukkah to you. We're somewhere in the middle of Hanukkah right now, so happy Hanukkah. And right now we are speaking with Dr. Lauren Korman. He is from the Vancouver Psychotherapy Center. Welcome back to the show, Dr. Lauren. Hi, thank you. And we have someone here at the station who came in. Did you have a question, or are you just wanting to sit in?
Just want to sit in.
Just want to sit in? Okay, cool. So he's liking our conversation. Now, where were we? We were talking about emotions and how some people have more sensitivity, or if they've gone through some kind of trauma, abuse, neglect, then they're going to have more dysregulated emotions. So
you were saying that even though emotions are really helpful, typically they're really adaptive, they still can become really dysregulated and stop working for the person.
So my question for you is, what about these people who, because I've talked about this on my show, I had neglect and abuse and all that. I grew up in foster care. It was a hell hole. But anyway, so that's why I've been in DBT, and it's been really helpful to me. But I still find that I am extremely, I would probably call myself a highly sensitive person. So I am quick to react, and even though I do have these mindfulness skills and I have exceptional interpersonal effectiveness skills and all of that, they still come up, and it's still a constant challenge. So for people who are just generally more sensitive, whether it's just in their biology or because of something that happened to them, are they ever going to be less sensitive?
Oh, I think so. Absolutely. I mean, are they going to ever be not sensitive? Probably not. And nobody would want to not be. I mean, I can't imagine that many people would want to be not sensitive at all. So I suppose probably if you're born highly sensitive, you may always be a sensitive person, but I don't think that you need to be highly sensitive. I mean, what you see often is people will be sensitive to particular kinds of cues. So they're not necessarily sensitive to everything. Mm-hmm. So for example, some people will be very sensitive to cues of rejection. Some people will be very sensitive to cues of violation. Some people will be very sensitive to other kinds of cues of loss. People will be very sensitive to any kinds of cues associated with shame, for example. Something will happen in a group, for example, where the next thing you know, the person is incredibly angry. Nobody knows what just happened. Well, something happened where the person felt incredibly ashamed and then reacted with secondary anger, where shame was the first emotion because they were very highly sensitive to shame. So there you have two different kinds of dysfunction, of emotional dysfunction in the same person in the same moment, unfortunately, where you've got very high sensitivity to shame, no awareness of that, and then reaction with a secondary, a reaction to the shame is anger, where the person is then lashing out at other people. You can reduce that, and we've done that with many clients, and most DBT therapists do that for a living. You know, they will, with their client's permission, they will find out the kinds of cues, the kinds of situations that, if the person's really sensitive to shame situations, they'll find out those kinds of situations that they're really sensitive to, and they will figure out how to actually come up with a hierarchy, come up with a list of, together with their clients, of situations that evoke intense shame, and they'll toughen their clients up. Expose them to situations, not like horrible shame-producing situations, but situations that in the past otherwise would have evoked intense shame. So, for example, you ask somebody, you ask your client, have you done your homework? And the client hasn't done their homework. And whereas, maybe you would say, I'm sorry, let's talk about what happened that I didn't do my homework. If a person was intensely sensitive to shame, they might explode in the session. So you might, for example, with your client, make up a whole list of things that the person has not done as well as they wanted to, and you would talk about it with the client until the intensity of their shame came down. And those kinds of interventions, they work, right? And people will get less sensitive to them. They'll react less with anger, they'll react less with shame, they'll react less with fear.
So it sounds like you're almost saying it's similar to like if someone has a phobia, like they're scared of flying, then they would expose themselves to flying again and again to become desensitized to it.
That is exactly right. It's almost the same thing, in fact.
Interesting. Well, we only have 10 minutes left in the show, and I may or may not play a song depending on how much time we have. So I'm wondering if there's anything, any direction that you would like to focus in for the last bit of the show.
Good question. Well, I just wanted to say, that DBT is a great. I've spent most of my adult career doing DBT. There are other forms of therapy that also work well with people with borderline personality disorder. They're just not that available typically in Canada. But I guess what I want to say is one of the main contributions that DBT made, that Marshall Linehan made in particular, was that there really weren't any scientifically supported treatments for borderline personality disorder before 1991, 1993, before she started publishing in the area. I guess one of the things that concerns me, and I don't know how we would focus on this, is that basically there are so few publicly funded services in British Columbia, particularly for adults with borderline personality disorder. And of course, we're talking mostly for women who have been traumatized, right? For women who have been physically, sexually, emotionally traumatized and abused. And it's not that I'm not exactly sure how we would focus on this, but I didn't want to state this because this is an ongoing concern. And most folks who have sought treatment in British Columbia will know this, that if they don't have money, the actual treatments that are available to them are minimal. Mm-hmm. And so what then happens is they may or may not get a diagnosis of borderline personality disorder if they see a physician. And there is no medication, there is no first-line medication treatment for borderline personality disorder. So for people with BPD, treatments, ancillary treatments can be, like medications can be very helpful, right? But they're not going to target the whole borderline personality disorder. So that itself, the medication itself is not curative. It can reduce impulsivity, or it can, reduce irritability, but it will not be able to target the disorder as a whole. And this is a huge issue, in my opinion, anyways, in British Columbia, that there are not more publicly funded treatments available, particularly for adult women with borderline personality disorder.
Thank you very much for that. And so, because if you have something like schizophrenia or manic depression or something like that, you can go to like a mental health team. So it sounds like you're saying for someone with a personality disorder, there's no access to free or government-funded care.
Well, I guess the question is, what is the government-funded care that these folks get? Some of the mental health teams, I think, welcome people with borderline personality disorder. Some do not. But there's not a medication. So it's not a medication. So, for example, if somebody is diagnosed with bipolar affective disorder, if they have what we used to call manic depression, then there is a medication first treatment for that. But there isn't for borderline personality disorder. And so what you tend to see, unfortunately, is that people who will go for treatment and they won't be diagnosed with borderline personality disorder, either because the care provider may be worried about the stigma associated with the diagnosis, or because it's just easier to treat somebody, frankly, with a different disorder with medication than it is actually having to find psychosocial treatments like psychotherapy that doesn't exist in the publicly funded system in British Columbia, or that hardly exists.
Well, that brings up another question, and we do just have a few minutes left, but I even had a neuroscientist who is schizophrenic. You've probably heard of her. She was on the cover of the Georgia Straight a few months ago. And even she had a hard time getting diagnosed with schizophrenia. So whenever there's a mental health condition, it can take a really long time to get an accurate diagnosis, correct?
Yes, it can, yeah.
And so what are some of the reasons for that, do you think?
I don't know globally. I mean, it may just have to do with the limits in available services in BC. Now, sometimes it may have to do with the fact of how the person presents in one time. You know, so for example, if somebody's under the use of, if a person is under the influence of substances, it's very hard actually to make a clear diagnosis until the person has been clean for about 30 to 60 days. With BPD, though, I think it's a specific problem with borderline personality disorder, and that is because I think clinicians are reluctant to diagnose people with BPD, partly I think because there's a stigma, that there's been a long history of blaming people with borderline personality disorder, right? That they're, you know, impulsive and they're difficult people, nobody wants to work with them, which I think much more reflected, I think, the lack of availability of treatments that worked in the past. But now there are lots of treatments that work, right? There's mentalization, there's transference-based psychotherapy, there's DBT, and so forth. And so there's really no excuse not to diagnose somebody with borderline personality disorder. But the only problem is that the publicly funded treatments don't exist.
So is there any way as a psychotherapist that you would encourage people to, I mean, how do we go about changing that? That's
a $1 million question. I think that the problem is that folks with BPD, when they're right in the middle of it, they're not going to probably be in a great place to be able to galvanize, you know, to group it together. I think that they've got to go to their members of parliament, frankly, or their members of the legislative assembly. I think that without some kind of political mobilization, there will be no change in the public system. I think for one thing, I think that folks with money unfortunately get treatment in BC. So if you can come up with the money to go to one of the centers that treat people with borderline personality disorder, right? There's a couple of them, right? Then you can get treatment. We've got a number of psychiatrists. I mean, we've tried to kind of figure out how to actually make the services available to people who either have no money or who have little money. But I think that folks need to galvanize to force the health authorities, to put pressure on the health authorities, to come up with the money, to come up with the political will to actually fund multidisciplinary treatment services where they belong, places like St. Paul's Hospital and other places where we know folks who, places that treat, for example, the downtown Lower East Side. These people they're vulnerable. They've been victimized. About 3/4 of them have been victimized. They're vulnerable. They're not necessarily going to be showing up on voting day to vote. They're disenfranchised part of our citizenry who are not getting treated. But I think until we figure out, I don't know the answer to that, really, Marie, but until we figure out how to bring pressure to bear in the political system, I don't think anything will change here.
All right, well, thank you so much for your time, Dr. Lauren Korman. That is all the time we have today because Parts Unknown is coming up in just a moment. So I want to thank you so much. And does the Vancouver Psychotherapy Center have a website? How can people get in touch with you?
Oh, we do. We have a website. I think it's Vancouver VP. I'll just actually check. It tells you how much I know about our own website. I'm looking. You can look for us at vanpsych.com. vanpsych.com.
All right. Well, thank you so much for your time. That is all the time we have today, so I'm going to have to let you go. But I really appreciate your time and your knowledge, and thank you so much for coming on the show today. Thank you. Take care. All right. So again, that was Dr. Lauren Korman, and you can find him. He is at the Vancouver Psychotherapy Center. This has been Synchronicity Talk Radio for your mind, body, and soul. I'll be back next Monday, and then that'll be it for the rest of the year for Synchronicity. So happy holidays, happy Hanukkah, be well. I love you so much. Namaste. I'm gonna be around Monday. There we go. Bye.